Welcome to the segment on recovery after open heart surgery. The length of your recovery at home depends on your general condition and the type of surgery you had. Your doctor will tell you how long this should be. During this time, you'll need to take special measures to help you heal and lay the foundation for healthy days to come. In this segment, you'll learn about caring for your incisions, taking medication, eating well, self-monitoring, balancing rest and activity, making follow-up appointments, gradually increasing your activity level, and managing your emotions. Of course, always follow your care team's instructions if they're different from what we say here. And don't worry about memorizing every detail of this video. You'll also get written instructions to use at home. After open heart surgery, you'll have at least 2 incision sites to care for: your sternum, breastbone, where the surgeon cut to reach your heart, and the site where the chest tube was placed to help drain blood after the surgery. If you had a coronary bypass operation, you may also have a site where a blood vessel graft was taken. The incisions might be closed with stitches, staples, or a skin bonding compound. Sometimes stitches have strips of tape over them. Your surgeon will explain how your incisions are closed. Here's how to care for your incisions. First, check every day for signs of infection. It's normal to have slight itching, redness, or soreness. But call your doctor if the site is very red or hot to touch, if it's draining more than it used to be, or if the fluid has changed color, if there's a foul smell, or increased swelling with a fever. Keep your incisions clean and dry while they're healing. It's okay to gently wash in the shower, but avoid baths. Don't put any lotions or creams on incisions until they're healed, and keep them protected from the sun. If you have strips of tape over the incision and they haven't fallen off after you've been home for a week, gently remove them. But don't try to remove stitches or staples. Your doctor will do that for you. Finally, you may notice a slight movement or clicking feeling in your sternum, the bone at the middle of your chest, when you move or turn. This is normal and will disappear over time. After surgery, it's important to promote good circulation and prevent blood clots. You can do this in several ways. Wear support stockings, TED hose, as long as healthcare providers tell you to. Put your legs up while you're resting, and if an artery from your arm was used for bypass surgery, keep your arm up also. Avoid crossing your legs while you're sitting down, and don't sit in a chair for more than an hour at a time. Get up and move around a bit. Most heart surgery patients leave the hospital with medication to help prevent further heart problems. You will see these on your discharge sheet, and someone on your care team will go over them with you. Listen carefully, ask questions, and take notes. Make sure you understand what you're taking, why you're taking it, and how to take it. At home, take your medication as prescribed and take only the medication you were prescribed. If you were already taking medication, herbs, supplements, or over-the-counter medications before your surgery, check with your doctor to see if you should keep taking them. Don't stop taking any medication unless your doctor tells you to. You may leave the hospital with a small supply of medication, but you'll probably need to refill this prescription at your regular pharmacy. Ask your care team if you have questions. Finally, tell your doctor or pharmacist about any side effects you notice. This information can be important to your care. Nutrition and exercise are important for your heart health. So important, in fact, that they are covered in their own segments in this Heart Care series. This segment just covers what you need to do during your initial recovery. After your recovery, you can ease into a heart-healthy eating plan. Now, you may not have much of an appetite when you get home, but you need to eat to heal and build strength. Here are some tips that will help. Eat small, frequent meals. Big meals make your heart work harder. Rest for 30 to 45 minutes after a meal. Cut down on caffeine found in coffee, tea, many sodas, and chocolate. Eat a variety of foods. If you're just not hungry in the first few weeks, tempt yourself with foods you really like. If your care team recommends a supplement drink to help boost your intake of nutrition, take it as directed.
Right after surgery, my appetite was horrible. I didn't want to eat much of anything. Nothing sounded good. I just didn't want to eat, so that was a hard part to get through. I just had to force myself, say, okay, you need to eat. That's the only way you're going to get through this, and just forced myself.
To help your recovery stay on track, pay attention to your symptoms. Because a fever can be a sign of infection, take your temperature every day for the first 10 days. Call your doctor if you have a fever that doesn't go away or sudden fever over 100.4 degrees Fahrenheit. Weigh yourself every day and write down your weight. You should weigh yourself at the same time each day and with about the same amount of clothing on. The best time is first thing in the morning, after you've emptied your bladder, but before you've had breakfast. Your doctor will tell you the amount of weight gain to watch for. Generally, you should tell your doctor if you gain several pounds in a day or a week. Notice your heartbeat. After surgery, you might feel an irregular heartbeat or racing heart. Call your doctor if it lasts for more than a few seconds, especially if you also feel lightheaded or weak. Pay attention to your pain. It's normal to experience some pain or tightness in your shoulders or upper back or around your incisions. But if your pain medication doesn't manage the pain and you can't do daily activities, contact your doctor. Use your spirometer 3 or 4 times a day for the first 10 days to measure your lung capacity and help your lungs continue to expand. If your lungs aren't getting stronger, or if you have increased trouble breathing, call your doctor. Right now you need rest and activity to help your recovery. Here are some tips for balancing the two. First, get at least 6 to 8 hours of sleep every night. During the day, take naps if you like. Just don't let them interfere with your nighttime sleep. Limit your social activities. Keep visits to about 10 minutes for the first few weeks. Going to the movies or out to dinner are both fine as long as you take it slowly. After a meal or sex, rest for an hour or so. By the way, yes, sex is safe after heart surgery. It puts about the same stress on your heart as a couple flights of stairs. So if you can climb 2 flights of stairs, you should feel free to resume sexual activity. Take frequent, short breaks throughout the day. You can keep up with most of your regular at-home activities, like personal grooming, light housework, and going up the stairs. Just take things slowly and rest when you need to.
There are times when you have to serve yourself. You have to take care of yourself first, especially if you have others depending on you. If you've got dependents around you, then the first thing you have to do is take care of yourself so you can take care of them. And the emotional side of surgery is that you may tend to not take care of yourself.
During your recovery period, there are several things you should avoid. Heavy housework or yard work like vacuuming, scrubbing the floor, mowing the lawn, or shoveling snow. Lifting anything heavier than 10 pounds. Twisting your torso. Activities that require you to keep your arms up or behind your back, like washing windows or golfing. And straining with bowel movements or to open jars or windows.
I would advise anyone with a heart surgery, the next 4 months, don't get your clippers and go out there and clip the hedge, because you'll take one swipe and you go back and sit down.
Besides rest, activity also helps your recovery and ongoing health. Cardiac rehab staff will work with you to make a plan to increase your activity during your first few days at home and then work into regular exercise. Participating in outpatient cardiac rehab is strongly encouraged and can help to keep you on track.
Well, it was nice because I could go in, have monitors on me, and they could tell me if anything was going wrong with my heart, if the beat wasn't right, and they could monitor my heart rate to tell me when I was going to overdo it, and just helped out a ton.
Your activity plan will tell you how often, how long, and how hard to exercise. It will begin with very light exercise several times a day for just a few minutes. Week by week, your plan will help you build up to longer and harder sessions once a day. As you use your plan at home, follow these guidelines. For the first few weeks, stay in your house or very close to home for your physical activity sessions. If you leave the house, take someone with you. Start each session with the gentle warm-up moves that you learned in the hospital, and avoid exercising in extreme heat or cold. Don't exercise so hard that you're exhausted. After a session, you should feel a little tired, but not so tired that you need to lie down for hours.
For me, it felt good because I could actually kind of test myself and say, okay, I'm not going to collapse right here and right now. You know what I mean? This kind of feels kind of good to get a little bit of a sweat. It feels kind of good to, you know, it's like feeling your body. It's feeling your body, and that it can respond, that it does have a resilience and it can respond to you. And it can tolerate some level of exercise and work. It's not so feeble that you can't move.
After you leave the hospital, you'll need to make follow-up appointments with your care team. You can start going to outpatient cardiac rehab within the first few days. The cardiac rehab staff will communicate with your care team to keep them up to date on your progress. Your care team will also ask you to schedule follow-up appointments with your cardiologist, your surgeon, and your primary care provider. Be sure to keep these appointments. Your care team needs to see how you respond to treatment, how your recovery is progressing, and whether they need to adjust your treatment. After heart surgery, many people are eager to get back to work and the comfort of a familiar routine. Your care team will give you advice on returning to work based on your condition and the type of work you do. Likely, they'll tell you something like this. First, don't hurry to return to work. It's important to give your heart a chance to heal. Expect to wait at least several weeks, maybe longer. When you do go back to work, ease in gradually. If you can, arrange for shorter days or lighter duty assignments. Don't drive until your care team tells you it's safe. You'll probably need to wait at least several weeks to make sure that your reflexes and your strength are up to the job. If you're riding as a passenger, try to keep trips short. On longer trips or flights, stop the car or get up from your seat to walk around and stretch your legs. This lowers your chance of blood clots. If you watch the Heart Basics segment, you know that as a heart patient, you'll probably have emotional reactions to your heart problem, such as worry, anger, or fear. These are normal and typically ease over time.
I think that the emotional side of major surgery is underrated. A surgical incision in the body is a tremendous trauma, even though you feel no pain at all. You're not even there, you're unconscious. Most of your recovery from this surgery, male or female, is right up here.
Reach out to friends when you need encouragement. Your healthcare team can put you in touch with a volunteer, counselor, or religious guide. And we can connect you with a case manager if you need practical help with transportation or sorting through bills. Talk to your doctor right away if you start feeling you want to give up on life. This is a serious symptom of depression, which your doctor can treat. Other symptoms include being worried or sad much of the time, not being able to sleep or sleeping too much, or losing interest in things you used to enjoy. If you have any of these symptoms, especially for longer than a few weeks, tell your doctor. Depression can be common with a heart problem, but you deserve a chance to feel better.